Hi, and welcome to the show where we share the stories of the many who intersect with our healthcare system but are rarely heard from. My name is Kevin Poe, founder and editor of Kevin MD. Today, we welcome back on the show Dr. Ni-Cheng Liang. She's a pulmonary physician, and she wrote the Kevin MD article, COVID-19 Becomes a Magnifying Glass for Health Disparities. Ni-Cheng, welcome back to the show.
Thanks so much for having me again, Kevin.
So for those who didn't listen to your first podcast, can you briefly share your story to where you got to today?
Yes, absolutely. So I'm a pulmonologist practicing in San Diego, and I'm a cancer survivor. So got breast cancer at the second year of my pulmonary fellowship. And that cancer experience has really informed how I returned back into the practice of medicine, having been an integrative medicine patient to help with my mindset, as well as my general health and well-being, even to this day, after receiving allopathic medicine that saved my life. Particularly, mindfulness meditation has been a daily routine for me, and also something that I incorporate into my practice of medicine with my patients and for healthcare professional well-being. So thanks for having me back.
Sure. Now, you wrote a wonderful Kevin MD article, COVID-19 Becomes a Magnifying Glass for Health Disparities. Now, for those who haven't read that article, can you walk my audience through it and share the story of why you decided to write it?
Yeah, absolutely. So it was during the onslaught of increased racial tensions brought about by the George Floyd murder, and how dehumanizing that whole situation was, and how angered the nation became. And ironically, but also how perfectly, that this whole situation intertwines with also coronavirus, and how I am reminded daily of the health disparities that exist currently in where I practice medicine. And that's that every day we get this daily update of coronavirus cases in the Scripps healthcare systems that spread up and down the San Diego County coastline, basically. And the further south you go, the more cases there are. And that is a glaring direct representation of socioeconomic status in San Diego. And so that kind of galvanized me wanting to draw connections between that, racism, how dehumanizing taking away the breath is, whether it be through racism or through having coronavirus. So that was the initial inspiration for the article.
Now, what are some statistics and details about the racial disparities when it comes to the effects of coronavirus?
You know, I actually don't know the specific data, but I do know that the Black, Indigenous peoples, and other peoples of color have worse outcomes compared to white counterparts. I can't give you statistics, though,
Sure.
quite just yet. I think the final numbers have yet to be seen.
And what are some of the underlying reasons?
Because coronavirus kind of magnifies the health disparities that already exist. So we do know that those who have chronic comorbidities such as diabetes, hypertension, high blood pressure with cardiovascular disease, chronic lung disease like COPD, which tend to have worse outcomes in people who are otherwise basically non-white, that already sets those people up for worse outcomes with something as virulent as coronavirus.
Now, what are some of the answers? I'm going to ask you this from a policy level, but also from an individual physician level. So what are some things that we can do kind of on a macro scale, and what are some things that we can do when we're one-on-one in the exam room?
Yeah, on a macro level, the government has to really be behind change in our healthcare system. Like, a lot of practicing physicians agree with the statement that this is actually not a healthcare system, it's a disease care system. We're focused upon individualized diseases rather than whole person, holistic approaches. And so I think this reductionistic attitude towards health and wellness definitely has to change. So from a policy level, just from having worked in a safety net hospital before, and now with like Medicare dinging hospitals for over the mean number of 30-day readmissions. For a while, safety net hospitals were obviously potentially getting penalized more. And so could there be some legislation that's passed. And I know that there was House legislation that was trying to get passed a couple of years ago about protecting these safety net hospitals, but like using health as an incentive rather than productivity outcomes.
Mm-hmm.
I think that the healthcare system right now is incentivized kind of backwards. Like we don't get rewarded for true good healthcare.
And that's true. And we're certainly seeing that now as productivity goes down. You're seeing a lot of physicians and clinicians get furloughed or laid off because simply we're not seeing as many patients as we used to. Now, from an individual standpoint, are there any things that we can do to help with the disparities from an individual physician standpoint?
Yeah, I think that it actually has to start on an individual level rather than waiting around for even local state legislation and national legislation to change. It can start with all of us as individual practitioners. Because racism is so interwoven into the fabric of American society, I think just the recognition and the acknowledgement that it too affects medicine and how we were taught medicine. So racism is quite pervasive, and I think the acceptance of that, and then these individual kind of educational goals that you can have about educating yourself. There's a lot of great books now out there that have recently become like New York Times bestsellers because of recent events that you can take the initiative to read. Professor McGee's book is just one such example of that, where she introduces the concept of training yourself in color insight as opposed to this blanket statement or blanket philosophy of, oh, I'm not racist, I'm colorblind. But actually, genetically and physiologically speaking, our brains aren't wired for color blindness. Like whether or not you like it or not, our brains see color. And to get closer to the recognition of that, and perhaps getting some formal bias training, whether or not that's advocated for you from your healthcare system, but taking it upon yourself to do some of your own work in terms of implicit bias training. There's a lot of resources for that out there. Like I'm myself am currently enrolled in an anti-racism course because I want to become aware of things that I wasn't aware of just practicing medicine the way that I was taught. So I think the desire to change needs to be there, but then also more importantly, taking the action steps for you to change so that you can catch yourself in an otherwise situation that you might have glossed over as a potential bias situation. So it comes back to mindfulness and paying attention and being aware of why we practice the medicine the way we do. Like, could some racism even inform the way that we practice medicine in our own individual practices? And I dare say that at some level, it probably does, unfortunately. And so the awareness of that is step number one. Step number two is taking action, very intentional, purposeful action.
Now, you mentioned some resources about implicit bias, some resources about anti-racism. What are some resources that clinicians can look up online?
Professor McGee's website, rhondavmcgee.com, is a great starting point. That's more information about her work and the intersection of mindfulness and racism. And then Dr. Jill Weiner, who is on the executive board with me on the Mindful Healthcare Collective, she actually put together a curriculum with Dr. Maisha Claiborne to basically educate non-Black Indigenous people of color on anti-racism in healthcare and also for the general public. So you can actually just Google Jill Weiner anti-racism course. And then there's also implicit bias tests that you can take online. I believe Harvard has one, but I can send you references in an email for you to include in show notes, Kevin, later on.
Now, can you give some specific examples or specific scenarios where a clinician may be guilty of implicit bias, but he or she may not be aware of it?
So I think that it can become more obvious when you see a patient from different payer groups, for instance. So we have all these different insurance systems that some are known to serve the underserved. And so we know that their coverage is not going to be as complementary or comprehensive as someone who is able to afford better health insurance. And so I would challenge you to notice if the different prescriptions that you write or the referrals that you make, are they different between the two different payer groups? And sometimes that's quote unquote out of our control because some practices just won't take, unfortunately, the, for instance, in California, the Medi-Cal HMOs. So I think that noticing that, and then if there is a patient that is Black, Indigenous, or other person of color, marginalized group, are you able to bring kind of a critical but critically compassionate lens and reflect back on your patient experience to notice if the way that you treated that patient was different than the way that you treated someone who was Caucasian? So I think this curiosity, because if you don't ask yourself or catch yourself, you're likely to not notice any of this at all. And I dare say that even just looking at different insurance companies of the patients that you do see, and then on a subconscious level, if they're not white, you might notice that there are slight differences in what you offer as a clinician.
We're talking to Ni-Cheng Liang. She is a pulmonologist, and she wrote the Kevin MD article, COVID-19 becomes a magnifying glass for health disparities. Ni-Cheng, what is the take-home message that you want to leave with the Kevin MD audience?
My take-home message for the audience is simply to notice how you treat your patients. Especially notice how you treat your patients who are of Black, Indigenous, people of color. That's the take-home message. Because with awareness, then you can help foster compassionate change.
Ni-Cheng, thank you again for being on the show and sharing your insights. And thanks again for your time.
Thank you for having me on again.